Now for the next presentation for hypertension in children, we'll get to talk about various investigations that you might do for hypertension in children. So if a child has hypertension, okay, what are the various investigations you might actually do? Okay, so for the various investigations, sorry, I'm just trying to reply one of my friends. Now for the various investigations, first thing, you have to do a detailed history and physical examination where you ask questions around everything: when it started, okay, what are the order, how is the person feeling, and everything. Then you talk about the family history. Does anybody else in the family has all those hypertension issues? You talk about birth history. How was the child born? Was there any complications as the child was born? Do you understand? Then you talk about the other symptoms, that's other things that the person is feeling. You talk about the growth parameters and the body mass index. That's to try to rule out obesity, right? Then you also try to ask if the person has any other disease condition. That's to rule out secondary hypertension. Then you confirm the blood pressure, where you measure it with what? A sphygmomanometer, okay? Then laboratory tests, you do complete blood counts. You want to dictate anemia. Serum electrolytes, you want to see how electrolytes are actually balanced. Thyroid function test, you want to make sure that there's no hyperthyroidism, okay? Then you do urinalysis to check if there's proteins in urine, hematuria to check if there's blood in urine, and the rest of them. Then also renin and aldosterone levels, okay? So imaging and specialized tests, you do things like renal ultrasound is the first line imaging to evaluate kidney size, structure, and anomalies. Then echocardiography to assess left ventricular hypertrophy. Then Doppler studies or CT or MRI angiography. Okay, that one is used to dictate renal artery stenosis or coarctation of the aorta. Okay, so basically these are the various investigations you do.